Hi, everybody, and welcome to the August edition of the Research Roundtable. We've got a great topic tonight. Our guest is about to log on, but I want to do a little bit of housekeeping to begin with. First of all, I'm Brenda Viola for Lympha Press, and I am behind the scenes moderating, looking at chat. We want you to ask your questions. We had so many questions last month, didn't we?
Did.
It was awesome. Of course, Dr. Karen Herbst is the cornerstone and the anchor of the Research Roundtable, and she will be interviewing Paula Donahue. And Paula, we just talked to her. She's coming on in just a moment. But as a little bit of housekeeping, first of all, please let us know you're here in chat. We want to know who is logged on, where you're from. We want to encourage you to put your questions in the Q&A. And I also want to mention that next month, you might think we'd take a break for Labor Day, but no, no, no. We are going to keep going. The Research Roundtable, instead of being on the first Monday of the month, will be on the second Monday. September 8th will be the Research Roundtable in September because we don't want to conflict with the Labor Day holiday, but we didn't want to miss a chance to have Dr. Leon Straub. And you wanted him on the show. Tell us why, Dr. Herbst.
The reason is because Leon spearheaded a new paper on lipedema, and he gathered together information from proteomics, so looking at proteins from the fat of women with lipedema, RNA from women with lipedema, blood, lipids in the blood, and then he used AI to kind of figure it all out and put it together. And there's some interesting take-home messages. It's a little bit controversial, and it's a little bit of a difficult paper to read. So I think having him walk us through it is going to be very important.
I love that background that you just gave because I also posted the link in chat and we'll also put it in our show notes because this, of course, is being recorded. We'll be posting it on the Lympha Press website. But you can go through that paper, our guests, and, really sink into it so you're ready with the questions for him. AI, it's interesting that you said that it was incorporated into his paper. Are you using it in your practice at all?
Oh, well, I do. I use it for mostly my genetics work, but it's not completely reliable. So everything has to be checked. For example, I went on Chat GPT and asked one question, then I went on Gemini and asked the same question, and I got polar opposite answers. And that really
Hmm.
tells you that you can't take everything that AI says as the truth.
Well, this is a great little bit of a commercial for those who have logged on. And by the way, I want to acknowledge Sue from York, Pennsylvania, Sandra from Rutland, Vermont. Tanya Holloway is from sunny Florida. We're glad you're here. Leela Chloros from Fairport, New York. We've got some new names here too, and we want to welcome you to the Research Roundtable. And of course, our dear friend Linda Ann Kahn is in the audience, Carol Moody in St. Louis, Darcy from Raleigh. I can't name all of you, but we're really so glad that you are with us. Any preemptive questions you might have for our guest about negative pressure, please do put them in the Q&A. And right on cue, there she is, our friend, Dr. Paula Donahue. You can get settled for a moment, Dr. Donahue, while I read a proper introduction for you. Paula Donahue is a research associate professor and physical therapist in the Department of Physical Medicine and Rehabilitation at Vanderbilt University Medical Center. She engages in clinical research and provides clinical care at the Vanderbilt Dayani Center for Health and Wellness. Did I say that properly, Dayani?
Yes, you said it perfectly.
Love when phonetics works. Thank you, second grade teacher. She received her training at Duke University, Northwestern University Physical Therapy at Human Movement Sciences, the Johns Hopkins Carey Business School, and the Academy of Lymphatic Studies. You've got so many letters after your name, Dr. Donahue. I mean, really, we're so grateful to have you here. And additional lymphatic certification from the Lymphology Association of North America. Primary research interests are in the area of lymphedema, lipedema, and cancer rehab. But tonight's subject is negative pressure. And I know that you are going to have a wonderful discussion. I'm going to disappear. And Dr. Herbst, I leave it to you.
Thank you so much, Brenda. What a great introduction. And hi, Paula. Long time no
Hi,
see.
great to see you.
You look amazing.
Thanks. You too.
So, we're talking about negative pressure therapy, and who better than to have you on as a guest? You are the negative pressure queen in my book. And we should mention that Lympha Press has added negative pressure to their therapy. So, if you don't mind, would you kind of start and give us like an introduction on what is negative pressure therapy?
Absolutely. Yeah. I'm super excited about what Lympha Press is doing. And just a quick little backstory when we started to use it in our clinic, I'd say about now 14 years ago, from a particular company that had brought to our attention the option, and started using it in the clinic. It became phenomenal. And one of my patients said, "Hey, wouldn't this be awesome if you could have this as a component to a pump?" And now here we are today. I remember when she told me this, I thought, go for it, girl. And then when I had heard sort of behind the scenes years ago about the possibility, I just thought of what Lympha Press was doing. I thought, this is amazing and wonderful. So let me take a step back for when people on this call have experienced, or if they've done manual lymphatic drainage, let's say, or anything specific to work on the tissue, what we're doing there is we're giving positive pressure. We're gently making contact with the skin. Let's just think for a moment about manual lymphatic drainage or any other types of massage techniques. We're putting pressure on our tissue when we're doing that to ourselves or we're doing that to others, and that's just considered positive pressure. Negative pressure is something that's going to be pulling the tissue. So if anybody had seen Michael Phelps in the Olympics, whatever year that was, where he had all those welts on his back as a swimmer, he kind of made negative pressure or cupping really popular at that moment in time if people hadn't known about it beforehand, because he had all of these big, huge dots that were circular dots from the cups on his back. However, what I like to tell my patients when we're using that type of device on our tissue, we can control how much pull, and we're not going to bruise or damage the tissue or create any type of capillary trauma like what was happening, which is why Michael Phelps, the famous swimmer, had made cupping so popular, because people are like, what are those welts, those big, huge bruises on the back? That does not have to be of concern when the clinicians are using it appropriately, and also the way Lympha Press is going to be putting it within their use of their tool, because we're not looking to bruise the tissue, but we want to pull the tissue in an opposite direction. So instead of giving pressure down onto the skin to then elicit a skin stretch and to stimulate the lymphatic flow, we can give a pressure pull up on the tissue and then again do the exact same thing, elicit a stretch or even some rotational motions, that type of option. So that's in a nutshell what a therapist might be using the negative pressure tools for. And it's been really helpful in stimulating the lymphatics in a different way. What my patients have said over the years is, wow, my everything feels lighter. It feels airier. It is a fantastic way to soften tissue. And it also helps to reduce the amount of work that even a clinician might have to do to try to soften tissue, or even if a patient is doing those techniques at home using their own types of cupping devices, and also having this as an option as part of a pump is super exciting, because it does a wonderful job softening hardened tissue like fibrotic tissue.
So now I feel like we're going back to the dictionary. So what
Okay.
is the benefit of positive pressure therapy, and how is that different from the benefit of negative pressure therapy, or do they both have the same benefit?
It's beneficial to actually use both. We want to stimulate and circulate and mobilize tissue in a 3D manner. And so by being comprehensive in the care now, you kind of want both positive and negative pressure. Mm-hmm.
So
Like,
they
so
both,
you
go ahead.
want, yes. So as therapists, we use both. We don't just use then, since we've got the technology in our clinic, we're not just using the negative pressure to pull on the tissue and mobilize it. We're doing both. We're in, to a certain extent, one hand, a therapist's hand, could be using a tool to pull up, while the other hand is not just idle, but it's also now doing positive pressure. So you can, depending upon how a clinician might practice or how a person might be doing it on their own. Theoretically, you can do both at the same time, not on the exact same skin location, because one's either being pulled this way or one's kind of being gently pressed down to then stimulate the lymphatics, but also to soften the tissue. But really, to answer your question, Dr. Herbst, it's really beneficial to have both if both are available. So it's wonderful now because since Lympha Press has this as an option for self-care, now it can become available. I do like to emphasize that a lot of great care can be had in clinics, even if they didn't have access to the negative pressure. I personally can speak for myself. I didn't know how this tool was going to really, really make a difference. And it was eye-opening of how beneficial it is to soften tissue, help mobilize lymphatics just in a different way than what we can do with our hands only, or even using tools with our hands. Some people might be familiar with therapists using tools to kind of soften scars, and that's wonderful. It's just really nice to be able to pull the tissue away. Here's another slight example of negative pressure for anyone in the audience who's had used kinesio tape to soften scars or to also to help with lymphatic flow. That's that stretchy kind of tape that can stay on for 7 to 10 days if it works okay for the person's skin and isn't too uncomfortable. Usually people find it to be comfortable, but sometimes it can be uncomfortable for certain people. That's gently pulling too, because what a therapist or if a person's applying it for themselves, when they're putting it on their skin, they're giving it that light stretch. And then that stretch, what's happening is now it's an elastic tape, so it's gently recoiling up, but at a much softer, lower level of awareness than when people experience a device that's literally going to gently pull the tissue up. That one's much more obvious.
So do you think, okay, let's talk about fascia and
Sure.
positive pressure, like myofascial release really helps improve the quality of the fascia, reduce fibrosis, improve flexibility. But I could see how positive pressure also would kind of reduce adhesions, improve pliability. I mean, it's like a vacuum. You're sucking out the fluid, right?
You use the word vacuum because for one of my patients that had swelling up around their neck after surgery, and it was a known lymphedema following cancer, but he goes, Paula, I think my vacuum, can I use my vacuum when I go home? Because he was like, this feels so good. So the negative pressure is wonderful for all the things that you just said. The company that we had gotten the tool from, and it's sort of an automated tool that the therapist, they used a name that it implies that it was only for the lymphatics, but I was letting them know, I'm like, hey, the value behind this tool is not just for lymphatics. It is for fascia restrictions, and it is for if you have micro trauma, let's say from like Achilles. Like it has so many benefits orthopedic wise, all things related to why we would want to be stretching the muscle, why we'd be wanting to stretch the fascia to elevate whatever the injury is. But no, it's absolutely beneficial for all those reasons. And then in the setting for lipedema, what we've noticed is that it's very beneficial to reducing the pain because we want to mobilize that tissue a little bit more so that's within a patient's tolerance than just if someone had primary lymphedema or if they had cancer-related lymphedema. Where with lipedema or lipedema, just for clarity here, we really want to get in and mobilize the tissue. It's a lot like what you've been talking about for years now. When therapists are kind of getting in there and kind of working the tissue, this is another tool that can allow for it. And it does make it easier for a therapist's hands to be doing this all the time as well. So, when a therapist is working all day, it's really nice to have both options, both with their hands and then a tool that's going to pull the tissue away because it just makes it easier.
Yeah, I'm thinking of two things. One, vacuum has been used for many years to improve wound healing because it increases blood flow into area and improves lymph flow out. So you're kind of cleaning out the wound, and wounds heal faster with the wound vac. But also something you mentioned, you can't get your fingers into small crevices.
Yeah.
You might be able to jam a tool in there, but with the negative pressure, you could pull fluid out of joint crevices and really clear out tissue that you can't get at with your fingers.
Well, and I think just having a multidisciplinary, just multi-directional approach is what's beneficial, because sometimes it's not just the pushing down and trying to mobilize it in a down and outward fashion or rotational fashion. And I think that's why it had become clear once we started using it in conjunction with anything positive, pressure wise on the tissue, it seems to clear things better, more effectively, and definitively. And it's probably like what you're talking about too. It's just a different approach, but it's mobilizing the tissue in a way that it benefits. The lymphatics are still being stretched. Areas
Mhm.
are opened up. It's really, honestly, it's fascinating. Back in the day when we first started using it, we were not sold on it, but we thought, okay, we'll give it a try. And it was just, it's quite effective. And I will say, when we utilize the tool, we're not holding it in a we're not holding it steady for more than 5 seconds. And where the pressure pull that's being used is staying within the patient's tolerance, but also, taking into account what that patient's skin integrity is. Some people will bruise, well, like with lipedema, the easy bruising. And so the quick movements from one spot to another, and it doesn't have to be far, it's just not in the exact same spot over and over again, but we'll move up a leg or down around the knee or around the ankle, but only for a few seconds with each of the pull to allow capillary refill. So just to kind of allow for that tissue that just got pulled to be able to kind of relax back down, and it helps to prevent the bruising. It can, every once in a while we can get a little bit of the bruising by using it, but it's not much at all, and it goes away pretty easily.
So would you say that after they've had negative pressure therapy and had some really good results, that they might have a decrease overall in their easy bruising?
Definitely with a decrease in their pain. I
Okay.
think that you're bringing a wonderful idea for a study that I can't quantify for the bruising
Okay.
itself, but we have noticed that the pain tolerance, the experience of pain, in the limbs reduces, and sometimes pretty quickly for certain people, which is an interesting surprise, because people will have had pain for years and not really know why. And then as soon as we kind of start really mobilizing the tissue, it reduces. I think, it's this, using this type of tool in conjunction with all the other options for manual treatments on the limbs is just a really nice, more comprehensive way of treating. So when it's an option, it to me is a really good option to also seek out and to use.
Well, I like how you say it's a 3D treatment. That
Right.
makes complete sense to me. And we talk about, lymphedema tissue, lipedema tissue being congested. And
Mhm.
so you need to mobilize it. Well, doing it in one plane doesn't make any sense now that, you're saying this. It makes absolute sense to do it in a 3D.
Well, and a lot of the therapists and patients too recognize that they weren't just going one unidirectional down and that's it. It's always eliciting a type of stretch. And many times people are also very aware that they were trying to maybe with the stretch do, I'm going to go this direction, but just pretend that we're pushing down on the skin. But would maybe their therapist might say go up and down, side to side, maybe even diagonal, do some circle rotations, mainly if we're in an area that has a lot of fascial restrictions, a lot of tissue tension, or if we're just in a spot maybe with scars, because it's really important to mobilize scars because that can impede lymphatic flow, even if they're old scars. I mean, they could be 15, 20 years old, and it's livable tissue. So we can still influence that scar, and we'll notice when we help to reduce the scars that people's locations of swelling or pockets of swelling around that scar can soften and reduce. So we're just educating them, the patients, that that scar has a lot, it looks minor on the surface, like maybe just a
Right.
single line or just a very innocent dot, but it can be gnarly and extend its wings all over the place, especially when we're talking abdomen too. And a lot of people get surgeries done on their abdomen, and for a variety of different reasons. And we don't do much scar mobilization. They oftentimes aren't going and seeing therapists. We're not even being told to wear compression. So we're missing a huge opportunity for education when people have those types of scars, tightened tissue. And this is just a wonderful tool to aid that freedom. Loosen it up and loosen it up in a 3D capacity. So instead of, like, I like to also explain it's instead of only if we want to mobilize tissue similar to like a sphere in all the different directions, 3 dimensions, all the techniques that we're aware of where we give a downward pressure, that's just the bottom half of a sphere. We might be doing it rotationally up and down and side to side, but we're missing the upward half of that sphere. And that's what negative pressure can do, because we really can't pinch skin very well. We can try as therapists. It's not uber comfortable in certain areas, lend itself towards a little bit of a lifting up, but really these types of tools, this negative pressure gives the opportunity to mobilize that upper part of the sphere.
Yeah, and there's so much scarring in,
Mhm.
lymphedema and lipedema tissue. Even with vein disease, you can see a lot of scarring. And I was thinking while you were talking that I had a patient today who had multiple uh, C-sections in the same spot, multiple. So you're
Mhm.
just reinforcing that scar over and over. So many women have C-sections. It would make sense to use this tool there. And you can see there, you can see things are not draining around the scar as well as they should. And that's common.
I know it is. It's really common. And from what my understanding, I mean, I'm not a surgeon, but my understanding is oftentimes when we have to do multiple repeat abdominal surgery, C-section's a great example of multiple times, they're using similar scars out of the hope of reducing the scarring down. Sometimes when they go back in, I'm told that a lot of times the surgeons will try to reduce the scar that's there. And,
Yes.
but they're still laying down a new scar, and it really lends itself towards, we like to ask our patients, what are all the different types of injuries, in particular scars, that you have on your body? Because oftentimes when we're scanning the body, I mean, C-section is not a good example, but a lot of times our bodies can heal pretty well. And I might not be aware of, oh, there's an ankle injury or a type of a scar that was pretty deep. Because it can look so benign on the surface sometimes. So it's not just the gnarly scars that are gnarly from the surface, but these scars can look so beautiful, even up to the point where a skilled clinician can skip over that tissue, not seeing that scar, but yet that scar can have a huge influence internally. So I think it's really valuable to talk to clinicians when patients are seeking out care for all the different types of scars or injuries that they've had that were pretty significant, even if it wasn't a surgery, but that took a long time to heal. Because oftentimes there might be a lot of scarring that's occurred in that tissue.
So do you think it's a good recommendation to recommend something like negative pressure therapy for a woman who has lipedema or lymphedema or venous disease or even abdominal obesity, to have that scar treated after she's healed? I
Absolutely.
think too. I mean, that's just making it like it's like common sense to me.
It is, yes. I mean, it is, it's kind of word of mouth for right now, because we don't really even for where we are, we don't have an automatic referral for most especially abdominal surgeries, and we should. I mean, if we look at it from the perspective of after a total knee replacement, patients are hopefully being told how to mobilize scar, and the therapist is mobilizing the scar, but that's just to try to help with that knee range of motion. We're looking at it from an additional standpoint of, wait, we want to make sure that we're allowing for good mobility underneath so that we can have equilibrium of fluid and not have a lymphatic problem, especially in the setting of where a person is at risk for lymphedema or has a history of lymphedema. So
Wow.
absolutely,
Yeah.
all of are mobilization therapies, negative therapy options, I think are really good from what I have seen as a clinician, and can tell the difference with our patients. What was interesting when we first started using it in the clinic, the best way for us to learn how to use it most effectively and if it made that much of a difference was working with our patients where we knew their bodies really well, where they would get a positive benefit from the traditional style manual techniques. But that's where we quickly learned, wait a second, this is a big deal and it's making a difference. And our patients could even tell. It's like, yeah, the therapy before was really good, but this is even better. It's hard to argue that one. It's like, wow.
So, given that now Lympha Press is providing negative pressure with the pump, the Optimal Plus, what's the sequence? Would you think that people would use negative pressure before they pump, or would it be they pump and then they use negative pressure, or before and after? Or what are your thoughts on that?
I think that those are all things that would probably be good for the person to explore. What we've found, we haven't done, I don't have any scientific data. So I want to emphasize this because I think we'll probably, I mean, this would be a great opportunity to obtain some more substantiated scientific, data to be able to guide. But what we learned, because we needed to kind of figure out when we're doing this therapy with patients, when's the good outcomes? In the early times for therapy, so early on with use and then maybe following with pump, or starting with pump and then using negative pressure and then following with the pump afterwards, that's where my gut is telling me, because that's what we found from a clinical standpoint is really valuable for therapy. I've found that I don't finish therapy with negative pressure pull, but then we'll follow positive pressure afterwards, just to kind of help smooth things out and get things further moving. But the negative pressure is very valuable early on to soften tissue, help to reduce pain, and to kind of get things flowing in an opening. It's almost like an opening up
It
opportunity.
is like the opens up the fascia and just allows movement to occur where movement hasn't been in a long time. I mean, that's
Yeah,
incredible.
absolutely. What's also fascinating is hearing my patients from way back yonder to even new patients when they're just experiencing it. Many people describe the experience of negative pressure similar, and they always apologize too. They're like, I'm sorry, I don't know if I'm using the right words, but they're using perfect words because it's how they feel. But I find it fascinating that they all describe it in a similar way. They feel like it's opening things up, it's expanding, it's making things feel looser and freer. And what's weird is I think in that world of like expanding, you'd think, oh, I'm not wanting to uh, increase volume, but that's not it. But that's what their body is experiencing, is just like a freer movement. And the best that I can come around with understanding how and why. And I've also used it on myself for my own orthopedic injury, and it made a substantial difference for me personally. And I felt something similar. I think what's happening is all of the downward work is important, but it also almost kind of congeals and makes everything feel really taut. And if you've got an injury, got pain, or you've got a lot of this fascial tightness, you really kind of want to make things feel more open and loose and freer. And I think that's what they're experiencing, which is why they say it just feels like it feels lighter and more open and airy.
So let me, while you're on that, I'm going to read something from Sandra Willis. She said, I'd like feedback on whether I'm explaining this correctly to patients with lipedema. I tell them that the cell walls become thicker and more fibrotic with lipedema. So the stretch that comes with use of negative pressure treatment provides a stretch that softens the wall and helps to relieve pain. And she uses also the roller wand.
Yeah. And I know with our manual techniques, we as therapists can feel like we can help soften tissue. Even with using a certain types of if a patient, if it's appropriate for a patient to even be using certain types of compression and swell spots, or different types of insert pads, we've got a lot of strategies that have been out there on the conservative side to help soften and to stretch that wall. it's kind of completing the job of something by being able to pull it in a different direction than what's otherwise going to be happening. That's
Yeah, I really think it's fascia. I mean, I think I talk about lipedema and lymphedema being like a cage around fat, a cage around muscle, and then you finally open the doors.
I've always liked how you've described that, and with lipedema, and I absolutely I feel like that could be exactly what's happening, because it's literally pulling the tissue, it's just pulling it in a different direction.
I love it. And Michelle Morris is asking, do scars have to be recent to benefit from negative pressure therapy? She said, I'm 23 years out from skin removal reconstructive surgeries after a gastric bypass. Could this still be beneficial for me? I also have many scars on my knees from multiple surgeries, including replacements.
I'm glad she asked this question so that we can emphasize the fact that it's still living tissue. There is not a certain time frame that we don't ignore old scars. We've found many scars that even seem like they couldn't possibly be the culprit here. And when we've worked on those scars and helped to open up and to release a lot of tension that's there, it's as if it gives an opportunity for the lymphatics to find another way for drainage. That
Nice.
out having any type of evidence behind it, but that's just what I've observed, and I like to emphasize that, since we also do research. So that's not coming from research, that's just coming from my clinical experience. And so all of our
Mhm.
team, we're very focused on making sure that we're helping to mobilize scars regardless of how old the scar is.
Kathleen Listen says, I'm 100% positive about negative pressure.
So
um, And
thank you.
Shannon Ellison says, have you been using manual cups or a machine in therapy?
We've been using a machine, but our clinic also has the cups as well, because that's what patients are using at home. And so it's a great way to be able to teach them the options as well for their own self-management. And many patients do go ahead and get silicone cups.
Mhm. And Alex Wolf is asking, can you use a Lympha Touch? And that's what is being uh, meshed with the Lympha Press. So if you get a Lympha Press optimal pump, you will have the option also to get a Lympha Touch with it, which is which is one form of negative pressure therapy.
Yes, and that's what I failed to ask Brenda if we were allowed to use the product name, but that's exactly what we use in our clinic.
Okay. And this kind of goes back to our beginning of the discussion. I'm sorry, I missed this question, but Lila Chloros says, I have found cupping to be very painful on my lipedema legs. Is this typical?
Okay, so maybe if while we're chatting about this, if you wanted to go ahead then to for the writer to answer this question I'm about to ask is, did you guys, when cupping, did you have control over how much pressure? And the reason why I say that is because we in the clinic, the tool that we use, we have control over it, so we can always make it where it's within tolerance. And what I find fascinating is many times if it's too uncomfortable for the positive pressure manual techniques, we can get the pressure with the negative pressure to be the device with the negative pressure actually is more tolerable. So I'm just kind of guessing that maybe with that too painful experience, maybe that's coming from the manual cups, or in a way where you can't control how much pressure is being pulled up in a way. And that's probably the advantage to having a device where you can control it.
So Paula, is that how you're treating all of your patients now? Are you using positive and negative pressure on pretty much so everybody?
Everybody who needs it. So what happens is when people start to not have pain and the tissue's gotten soft and we don't either have settings of scars or we don't have as much of scars, then we can start to move away from the need of using that tool. And people can do very well with their self-management, and they don't always have to, they don't have to get the cups. But now we're looking at something different. See, I'm coming at it from I didn't really have too much of an opportunity for my patients to have control over having that option for them at home. And now there's an option to being able to use it as needed for a person whenever, however, with what's the marrying together of the negative pressure with the pneumatic compression pump. So sorry, with the compression pump. And the reason why I say all of that is because I really like to empower my patients when they get discharged from therapy. I don't want them to feel like they're not getting something. It's just at the same time, it just wasn't as readily available. So to kind of answer your question, Karen, it's going to be one of those things where there'll be moments where it'll probably feel like, wow, this is exactly what I need to use all the time. And then there'll be moments in a maintenance phase where it's like, okay, this is what I'm benefiting from. Maybe it's not as intensive as it was. Maybe I'm not always needing to do the negative pressure every time with the pneumatic compression pump. Or maybe a person's going to find, wow, I don't have to, I can stay better managed by having this control at home by always using the negative pressure. And I don't have that experience yet from patients for me to be able to tell everybody one way or another.
And they now are empowered to use positive pressure and negative pressure at home. I mean, like, this is
Yeah, right.
phenomenal,
It
really
really
phenomenal.
up the doors for patients, honestly.
Yeah, I imagine there'll be some training courses coming up. I think Brenda could probably educate us on what Lympha Press is doing in terms of training courses for patients. But I think this it's just opening another door, and the doors keep opening, and that's so exciting because I feel like lymphedema treatment's still a little bit behind. And I was talking to Brenda today how I couldn't find any inpatient lymphedema programs. The
Oh,
typical ones people were like, check here, check there. And I checked them all again and there's none.
but yeah,
So,
for inpatient rehab where they get to stay. Yeah, that I remember. I don't. Maybe it was around like 2010. The last one that we were aware of had closed, and it's really unfortunate in the U.S. to not be
mhm.
there. There aren't any, to my knowledge, and I'm not aware of any that are looking to open up. But for some reason, they all kind of closed slowly.
Yep. So we need more ways that patients are empowered to take care of themselves at home because that's all they have.
Well,
You know,
it's probably even more beneficial because it's just like being able to have the pumps at home. That it can be life altering because now it's an everyday. It's like having your own personal therapist there to treat you once a day or twice a day, and to be able to apply this level of self-care where it's more, in my opinion, more comprehensive, I think is a huge gain for patient self-management long term.
so there's two kind of unique things to talk about in terms of negative pressure therapy and lipedema. In in lymphedema, the skin is thickened, but in lipedema, the skin can become very, very thin, especially on that inner upper thigh, that inner arm. Are there any? Would you change your therapy in those areas in any way because of that
Well, if
thin skin?
it can do a fantastic job even treating over thin skin. So it just depends. I'm looking to reduce pain with that technology to help stimulate lymphatic flow, and I might not be as aggressive with as high pressure or to stay there for as long. Even though I was telling everyone earlier, we really stay 3 to 5 seconds as a hold. We don't really kind of do that constant. There's some other techniques where you can keep it constant, but you're not staying there. You're actually gliding it along the skin.
Mhm.
Most important is we're not looking to cause any trauma to the skin. That's my utmost desire.
Absolutely,
Are
absolutely.
creating a lymphatic load by traumatizing the tissue, and that's
Yeah.
like don't want to be doing. But if I if the skin is soft, we're not really near a scar. A lot of times, the positive pressure is a good spot in that area, and then there might be other locations where it benefits. Those nodules do really well with the negative pressure.
Yeah, I agree. So
Nodule,
let's go even deeper
yeah.
because one of the things that we found on biopsies, and also I think other people have shown it, but the some of the vessels are dilated. And how do you think negative pressure helps those dilated vessels?
I think those are great questions that we would need future research to being able to, because I can't see that. So I
Mhm.
don't, I think it's a great question though. What's the influences? What's all the different tissue that's positively being influenced by it?
Because it is, as you mentioned earlier, there's so many different parts. It's the skin, it's the blood vessels, it's the capillaries, it's the veins, it's the fascia, it's the lymphatics, it's even immune function. And I know that I've said this for years too, just based on published literature, that fat responds to pressure. Fat cells respond to pressure. I would imagine that includes negative and positive pressure.
Mhm.
That they're being told, hey, you don't need to be there anymore, and you give it a little pull and it changes its actin structure. And it's linked to the extracellular matrix. You're improving the extracellular matrix. It's getting all this feedback like, hey, I don't need to be big anymore. I don't really need to be here anymore. I can turn back into a partial stem cell and get out of here.
That-
So I think in the long run, if the study were done right and long enough, you could probably show a decrease in fat tissue.
I hear exactly what you're saying. I think that is a great theoretical or a hypothesis to then kind of dive into.
Because
You know,
we showed
yeah,
it with the pump. We
yeah,
showed it, and who knows exactly why that was a decrease, but I bet you with positive pressure you'd see it. Go ahead.
yeah. Well, as therapists, we've always been trying to have people do certain creative stretches in a rotational manner, in an opening manner. And the intent behind all of that was to try to do more of what this three-dimensional mobilization of the tissue, whatever we're talking about. But I'm just going to colloquially just say tissue, whether that is fascia, muscle, if it's, scar, even if it's down to the cellular level, we're wanting to get it to move. That's what the normal tissue is able to do, that's not been adulterated in some fashion, even by trauma. So now, again, here we just have a creative way of something that is comfortable. It's not an uncomfortable experience. I heard what someone else had written in on the chat box. That just has to do with, then we'd want to tailor how much a pull is. I intentionally, when I first got the tool, I was like, okay, how can I hurt myself on this tool? Because I want to know how I can hurt myself so that I'm not going to hurt others. And of course we could pull any tissue too much, too hard. But if we can gradate and kind of, it's just a very comfortable experience. So our patients are usually like, wow, this feels really good. And the tissue wants to move that way. It's like it needs it in all the different directions. So
It's kind of like swimming if you think about it. When you're in the pool, and you watch your leg tissue move, like how does it even do that? How does it go so deep uh in the water? But it's moving in all directions in a very deep manner. And that's, I think, what this negative pressure is. And Linda Ann reminded us on the chat that nerves, I forgot about nerves, and you had mentioned pain, but she said negative pressure is a sustained stretching and elongation, which affects the Ruffini endings in the superficial fascia, and this can help with reduced sympathetic tone and possible reduction of pain. So, I mean,
that's,
that makes perfect sense.
yeah,
That's
absolutely.
the nerve environment's changing
Yeah,
dramatically,
yeah.
right?
I
And
know that. And it's just it's a tactile reinforcement to kind of help calm down some hypersensitive tissue. So I think that's a great add.
awesome. And Bethany Hanks said that her mother, who has lipedema and Derkham's disease, shared that cupping helped resolve one of her fat lumps. So, that's the inflammation part of it. And then also Lympha Press is posting training videos and information on negative pressure. So that's phenomenal. Thank you so much, Brenda. That's terrific. And let's see. I had some other question. I had another question for you. So one of the questions that still remains alive out there is there edema in lipedema tissue?
Mm-hmm.
And to me, it would seem like with negative pressure, you're doing so many different things. it wouldn't necessarily have to reduce edema, but what do you think? Is there edema in lipedema tissue, and what do you think this negative pressure does to edema?
Okay. Great question. And yes, for me clinically, I feel that there is edema within lipedema tissue. From what I've had the fortune of being able to work with my colleagues here and seeing the internal imaging, especially for the patient population that you wouldn't suspect that the lymphatic vessels would be more tortuous and what they would look like internally. So for me, for that, and then clinically, what we experience that with what patients run into too, I just feel as if there is edema in lipedema tissue. I know it is different and it's a different extent, and it can be there's a different approach even than that, as therapists can kind of be utilizing to help that patient. It's not necessarily the bandaging techniques that we would use immediately right away with patients who have primary or even secondary related lymphedema, unless a person with lipedema comes and when we're evaluating them that they're already at that stage of a secondary lymphedema situation, because we're treating as I'm physical therapist, and I'm treating the symptoms that are before me to help optimize a person's function and movement. With that said, this tool, this technology, negative pressure, works extremely well with people who have lymphedema. So it does help mobilize the lymphatics. It's just doing it in a different manner than when we are using our hands. And so when there is tissue, if there's a extra lymph fluid that's in the space, yes, I feel that the negative pressure also is helping to mobilize that fluid to get reabsorbed faster. That's why we use it in the clinic, in this
So,
edema. Yeah.
in one of the things I always think about with lipedema and lymphedema is that that interstitial organ is playing a role. We just don't talk about it as much.
Yeah.
But to me, negative pressure would really help move very quickly fluid through that interstitial organ. Do you
Yeah.
think so?
Yes. I mean, it's just like where I think the manual techniques serve that so well as well. I just feel that this is another manual tool done in a different way than any of the positive elements to mobilize and to help stimulate the lymphatic circulation so that our bodies can heal itself. I mean, I think our bodies do a tremendous job of trying to take care of itself. These are just added tools to make it happen faster. And I think you bring up a good point. I think that's why we really like to use it, and why the patients, when they knew what conservative therapy was like without it, and then when we started to use it in conjunction, they knew, hey, wait, this is something different. Very clear to state that when I experienced it with my patients and as we were going through it, nobody wanted it in lieu of the regular treatment. They wanted it with the regular treatment. And then, like I was mentioning earlier, we kind of had found that maybe one of the best ways to incorporate it is early on and in the middle of, and then to finish with the positive therapy, the positive manual techniques.
Yeah, positive pressure. I met one of your research subjects. She had gone through your therapy and she was stage 1, but like obvious lipedema. I mean, the smaller torso, larger legs. And she said, and she came to see me because of, we were doing a roundtable for research, and she had no pain anymore. So it wasn't just a one day, my pain has gone down. This was lasting. And I think that's what has struck me the most, because a lot of people I talk to, I say, have you done MLD? Well, yeah, but it didn't really help me that much, and
You know where that's a good point too, though, is that this is also a type of how do I want to put it? Sometimes when people have had manual lymphatic drainage, though, they've had the light MLD and they've never been able to experience how their body would do with more tissue mobilization.
Mhm.
done in an effort to improve lymphatic circulation, but also done in an effort to try to reduce pain and reduce fascial restrictions, reduce any scars. So this using these types of tools, it is always a little bit more than really, really light effleurage on the skin. Um, if that makes sense. So I kind of, I don't know. Um, I do wonder. I think you're absolutely right, Karen. I think that this would greatly help people with longer lasting, more dramatic results potentially. I like to be conservative in that statement because it doesn't like that the person that you're talking about. It worked tremendously for her on a single session, and it was dramatic and it was very long lasting. But that's not always the case. And if it's not the case for somebody, it's not that necessarily something was done wrong or that their body's not going to respond. They just might need more of the treatment, more repetition, which is where it's super exciting for them to have an option to do that in the comfort of their own as frequently as they want, not having to use insurance and go to a clinic. Like it makes it so much better for the patient to be able to have access to this type of thing at home.
So I guess for practitioners, we need to figure out how to order this for our patients, to designate it on the order that we want them to get the LymphaTouch with the Lympha Press Optimal, and it has to be the optimal. And then also, how do patients find therapists that can teach them about positive and negative pressure therapy? Is there
Mhm.
a way for them to look for? I usually tell my patients, make sure you interview the front desk person or somebody in the practice to make sure that they are going to go deeper into the tissue for you because you have a lot of fibrosis. But I guess one of the other things they should be adding on now is, and do they use negative pressure therapy?
I think that is a really good option to inquire on. My concern though might be that they don't have somebody in the area right now that's doing it.
Right.
So, it's kind of like it's not that that therapist doesn't know. It just kind of that's a I don't know. I don't know how to answer that one. That probably kind of leads more towards the need and the benefit for Lympha Presses in service and training all across the board. It'll probably raise the bar, raise the awareness for clinicians who are not already aware of the negative pressure options. And then it will, I'm sure that there'll be some maybe clinician training being done too. And I don't really know if there's any limitations to if they haven't had it done in the clinic. Is there any issue with being able to get the pump straight and have it as a home option? I know I'm asking you more questions a little bit. This is a little bit new for me for the home use, but these would be questions that we would, I guess, as clinicians want to know.
Yes. And I don't know if Eric Ansart's on, but I've talked to Eric about this, and um, the goal is to get patients trained even if they've not seen a therapist that has treated them with negative pressure therapy.
That makes perfect. I'm going to guess that also the insurance is not going to require that it was done in the clinic, but that's a
I,
guess, throwing it out there. Yeah.
yep, I agree.
And we've received a lot of interest and questions from our wonderful audience tonight about all of this. And my advice is contact your rep, whether you are a therapist and you'd like to be in service, you'd like to see how this works. Maybe it's not in your toolkit already. There's so much interest. Our reps would love to visit with you. And if you already have a Lympha Press, your rep's phone number is right on the pump. Reach out to us. The one thing I've heard, and I know that you would probably both agree, if you are dealing with lymphedema or lipedema, you want whatever tool you can have to get better. And our tagline is therapy that's easy to live with. We want you to get better. We want you to live well. And that's why Lympha Press is always innovating and coming up with new therapies and technologies to help you. So if you have a Lympha Press, reach out to your rep as well. We have experts in-house that will work with your prescribers and that will work with your insurance. We are in network with most insurances. We want to help you have access to all the tools that can help you get better. And here we are coming up on the 5-minute mark. Is there anything left unsaid? Dr. Donahue, what have we not covered that we must still?
I just think this is a great opportunity for patients, really, truly. And actually, I think it's a great opportunity for clinicians that to be exposed to it and to have this opportunity for their patients to have this at home. I think it'll make a big difference too in between therapy sessions, meaning we're trying to have patients be as decongested, reduced amount of pain, best, strength, mobility, whatnot in between therapy sessions. And I actually think this is probably going to expedite it. So I'm sure that there are a lot of future studies to come from all of this too.
Yeah,
And Brenda, I don't know if you can answer this, but if they already have a Lympha Press Optimal pump, can they switch something out and get the Lympha Touch added on? Or
the bottom line is, because the Optimal Plus was upgraded to accommodate the Lympha Touch, it would depend which version of the Optimal Plus that they have. But again, you never know until you ask. So reach out to your rep. They will connect you with what needs to happen for you to avail yourself of this. And many of you are interested in what it looks like. And so I do refer you back to the website. I'm going to put it in chat again. It'll show you exactly how this technique works on your body. And really, I've learned so much. Val Grace Wright Brooks says she's got a meeting with her lymphedema therapist tomorrow, and she's going to be asking a lot of questions about this. So we're excited to get them answers and to make this available to our patients who we care about deeply and the therapists who we love working with, because we never ever presume or would want to replace the hands-on therapy that you receive in clinic or in your appointments. But what the Lympha Press devices do is they help augment that and to support it. And it sort of gives the therapist's hands a bit of a break, doesn't it?
Oh, absolutely. I mean, the biggest, most important thing that for patients is to have the tools at their beck and call, and to have this as an added option is, I really think, will change people's self-management capabilities in between. So, and really, since therapy can't ever sit as a long-term, forever for life, it's kind of you pop in, maybe pop out of episodes of care from for chronic situations. I just would love to see it if people were noticing that they didn't even need as many episodes of care. I think this is a really, really wonderful thing, even for therapists, because our goals are we want to try it. We'd love a cure. I'd love, love, love a cure. Um, Obviously, the more that we can have people feeling better for longer times and not feeling like they're needing the therapist as much, I think that's a huge advantage. So
and
kudos
I imagine some practices are going to have the Lympha Press Optimal with the Lympha Touch. So for training patients and for also treating patients while they're in the clinic.
Awesome. Any final words, Dr. Herbst, before we close out?
I, I, Paula, it's just so great to see you. It was so fun talking to you. You are so knowledgeable. You speak so well in about this field, and you're so careful, but yet you have so much to share. And I just enjoyed you very much tonight, and I'm sure our audience did too.
And
Well, I really appreciate the opportunity to be here, and I hope it's just it's exciting. It's exciting to see things improve for patients in their own personal care for quality of life. So, thank you for
Great.
doing this and bringing it together. And this is a huge kudos plus to Lympha Press for making this a reality. Like I said, it's no joke. I really had a patient a long time ago say that this would be her dream, and now it's like it's coming to fruition.
we
That's
love
so
making dreams come true. Absolutely. And we're always thinking of new things and innovating. And with someone like Dr. Herbst as our chief medical officer, who's always thinking of new ideas. Right before we went live, she had a few more ideas that, keeps me busy. Keeps me busy and it keeps us all busy. It's all really good. Want to remind everyone also next month, don't miss the roundtable. It's just not going to be on the first Monday. It's going to be on the second Monday of September with Dr. Leon Straub, who will discuss his fascinating paper, and you're going to not want to miss that. Thank you, everyone. Thank you, Dr. Donahue. Thank you, Dr. Herbst. Thank you, guests, and for your chats and your questions. We appreciate you, and we will see you next month. Have a great night, everybody.